If you're over 60, this might be one of the most important health videos you'll ever watch. Dementia rarely begins with memory loss. It starts quietly, with subtle signs most people overlook. A change in how you walk, a shift in sleep, a fading sense of smell. But here's the hopeful truth. Some of these signs come from causes that are treatable, reversible, even preventable. In this video, you'll learn the 13 early signs of dementia and 3 steps you can take right now to protect your brain. Let's begin, because the earlier you act, the more you can preserve what matters most: your clarity, your independence, your life. Subtle changes in posture or gait. One of the earliest signs of dementia doesn't start in the mind, it shows up in the body. I'm talking about changes in posture or the way someone walks, also known as gait. Now, it's normal for posture to shift slightly as we age. The spine compresses, balance may become less steady. But what I'm referring to is a noticeable and unexpected change. Maybe someone begins walking more slowly or shuffles their feet. Maybe their stance becomes hunched, not from back pain, but almost as if their body is leaning in without reason. Or they swing their arms less when walking or seem hesitant with each step. Why does this matter? Because research now shows that neurological changes in the brain, even before memory loss, can affect movement, posture, and coordination. In fact, studies have found that these subtle motor changes can appear years before a diagnosis of dementia. I've had patients whose families said, "We thought it was just aging," or "He's been walking differently, but we didn't think much of it." Later, when memory issues appeared, they realized that the body was speaking first. Here's what I suggest. If you or someone you care for has developed a noticeable change in posture or walking, but without a clear explanation like arthritis or a known spinal condition, it's worth discussing with your doctor. A physical therapist or a neurologist can evaluate whether there's an underlying neurological cause. Early evaluation doesn't mean something is wrong. It means you're being proactive. And that can make all the difference. Because when it comes to protecting the brain, the sooner we notice the whispers, the better we can silence the storm. Have you noticed food doesn't taste quite the same lately? Or that familiar smells, coffee, soap, a flower from the garden, seem dull or even missing? Many people chalk this up to aging or allergies. But a reduced sense of smell or taste, especially if it develops gradually and without a clear reason, can be one of the earliest signs of dementia. Here's why. Your sense of smell is deeply connected to the limbic system in your brain, the same area that helps you process memory and emotion. When there's damage or decline in these areas, your ability to detect and interpret smells can fade. This isn't just theory. In fact, studies have shown that loss of smell may occur years before memory symptoms, particularly in conditions like Alzheimer's disease. I remember one patient, a former chef, who came in saying food had started tasting flat. At first, he blamed the seasoning, but tests revealed his sense of smell had declined significantly. A few months later, other subtle changes in memory began appearing. That conversation, that moment of noticing, it made early intervention possible. Now, to be clear, not everyone who loses their sense of smell is developing dementia. It could be due to sinus issues, past infections like COVID-19, smoking, or medications. But if there's no obvious cause, and especially if smell and taste changes come along with other signs on this list, it's something to take seriously. So, what can you do? Don't ignore sudden or gradual changes in smell or taste.
Bring it up at your next checkup, especially if other changes like mood, memory, or sleep are showing up too. And if you're a caregiver, notice when your loved one stops commenting on flavors they used to love, or starts using more salt or sugar to feel the food. Your brain is always giving you signals. Sometimes it speaks through the nose and tongue long before it forgets a name or date. And by paying attention now, you give yourself the power to act early.
3. Changes in sleep patterns. Your brain may be telling you something. We all have the occasional restless night, but when your sleep pattern changes noticeably, especially later in life, it could be more than just getting older. What kind of changes are we talking about? You used to sleep through the night, but now wake up multiple times without reason. You find it harder to fall asleep or stay asleep even when you feel tired. Your sleep becomes lighter, shorter, or more fragmented without any known cause like pain or frequent urination. Or you start waking up feeling unrefreshed, even after a full night in bed. These shifts might seem small, but they can be one of the earliest signs that the brain's internal rhythms are being disrupted, a common occurrence in the early stages of cognitive decline. There's strong scientific evidence linking poor sleep quality to changes in memory, mood, and even brain structure over time. And here's something even more important. Poor sleep doesn't just signal cognitive issues, it can accelerate them. When we sleep, the brain goes through a kind of deep cleaning. It clears wastes, consolidates memories, and restores its balance. Without that process, small issues can snowball into bigger ones. I've had many older patients tell me, "Doc, I've always been a light sleeper." That's fine if it's always been that way. But if your sleep has changed recently, become more irregular or broken, it's worth exploring. Especially because other treatable conditions can mimic this pattern too. High blood sugar can cause nighttime urination. Sleep apnea can wake you gasping for air. Restless leg syndrome may be disturbing your deep sleep. All of these are manageable and worth identifying early. So, what can you do? Aim for at least 6 hours of quality, uninterrupted sleep each night. If you can get 7 to 8, even better. Avoid brushing it off as normal aging. A sudden change in sleep is a signal, not a sentence. Talk with your doctor. They may suggest a sleep study or screen for underlying causes, many of which are reversible. Sleep isn't just rest, it's restoration. And when it starts to falter, your brain may be quietly asking for help. Listen early. Act early. That's how we stay ahead. Decreased muscle strength, when weak hands point to a weaker mind. Most people don't associate grip strength with brain health. But what if I told you that how firmly you can squeeze someone's hand might actually reveal something deeper about your cognitive future? Recent studies have shown a surprising connection. Older adults with weaker hand grip strength are twice as likely to develop dementia in the years ahead. Now, that doesn't mean every senior with a soft handshake is in danger. But when muscle strength starts to fade faster than expected, especially without an obvious reason like injury or illness, it's time to pay attention. I had one patient, a retired teacher, who came in not because of memory problems, but because she couldn't open a jar of peanut butter anymore. Her family thought it was just arthritis. But when we checked her grip strength, it had declined more than expected for her age. Months later, she began showing subtle memory slips.
Thankfully, because we caught it early, we could take meaningful steps to slow progression. So why does grip strength matter? Because muscle strength reflects more than just physical fitness. It's tied to nervous system function, including the brain's communication with the body, overall metabolism, inflammation levels, and even hormone balance. And yes, cognitive reserve, the brain's resilience against decline. Here's the key. Some muscle loss is natural with age, but a sudden or unusual decline, especially in the hands or arms, can be an early indicator of neurological stress, including dementia. What can you do? Test your grip. If you notice weakness when opening jars, carrying bags, or shaking hands, don't ignore it. Incorporate resistance exercises, even gentle ones like squeezing a softball, using light weights, or doing wall push-ups. And talk to your doctor about getting a simple hand grip test. It's quick, non-invasive, and surprisingly revealing. Muscle mass isn't just about strength, it's about stability, independence, and memory. Protecting your brain sometimes starts by strengthening your hands. 5. Apathy, when the spark fades quietly. Sometimes the warning signs of dementia don't show up as memory loss or confusion. Sometimes they show up as silence. You, or someone you love, stops wanting to go out. They don't laugh at the same jokes. The gardening tools stay in the shed. The knitting bag collects dust. The TV is on, but no one's really watching. Not because they're tired, but because they just don't feel like it anymore. This is called apathy, a quiet, creeping loss of interest or motivation. And it's one of the most overlooked early signs of cognitive decline. Let me be clear. We all have off days. We all get a little withdrawn sometimes. But when a person consistently stops doing things they used to love, or stops initiating activities, even simple ones like chatting with family or going for a walk, that's worth paying attention to. I remember a patient named Charles. He loved watching baseball, never missed a game. Then, over a few months, he stopped turning on the TV. He told his wife, "I just don't care who wins anymore." It wasn't depression. He wasn't sad. He was just indifferent. Later, he began having trouble with short-term memory. That change in interest, it was his brain's early signal. So why does this matter? Because apathy often shows up before memory loss. It's linked to subtle changes in the frontal lobe, the part of the brain that controls planning, engagement, and initiative. And if we dismiss it as just aging, we risk missing our window to intervene. What can you do? Notice the change, not just the mood. Apathy isn't sadness, it's a lack of drive, even for joyful things. Gently encourage engagement, but don't force it. Suggest simple, familiar activities. And if apathy persists, don't ignore it. Talk to a doctor. It may be the earliest clue to something deeper. Because when someone starts pulling away from life, it may not be their choice. It may be their brain asking for help, softly, quietly, and far too early to be dismissed. Number 6. Trouble with simple numbers, when math becomes a mental clue. Most people think dementia starts with forgetting names or misplacing keys, but one of the earliest signs, often hiding in plain sight, is a new difficulty with basic math. I'm not talking about calculus or complex banking forms. I'm talking about simple subtraction, like calculating change at the store or figuring out what day it will be in 3 days. Here's an example I often use with patients. Start with 100. Subtract 7. You get 93. Subtract 7 again. 86. Then 79. Can you keep going? This test isn't about intelligence. It's about how well the brain processes sequential logic. And research has shown that difficulty with this kind of simple mental math can signal early changes in brain function, especially in the areas that handle attention, planning, and short-term memory. Now, some people say, "But I've always been bad at math." And that's fair if it's always been that way. What we're looking for is a change. If someone who used to balance their checkbook or handle bills easily now struggles with basic math or gets confused by small amounts of change, that's a sign to investigate. I once had a patient who was a retired cashier, sharp with numbers all her life. Then her daughter noticed she was giving out the wrong change to her grandkids when playing pretend store. She'd laugh it off, but it kept happening. That subtle shift was the beginning of something more. Thankfully, her family noticed. So what can you do? Pay attention to small changes, like avoiding numbers, handing off the check at dinner, or miscounting doses of medication. Gently encourage practice. Crossword puzzles and number games can help keep these pathways strong. And most importantly, don't brush it off as just a little slip. Sometimes those little slips are the brain waving a flag. Because when numbers start becoming fuzzy, the brain may be telling you it's working harder than it should. And listening early can make all the difference.
7. Short-term memory loss. When today slips away, but the past remains. We all forget things from time to time. Where we left the keys, why we walked into a room, a name that's on the tip of our tongue. That's normal. But when someone starts forgetting what just happened while still remembering things from decades ago, that's a sign we shouldn't ignore. This is called short-term memory loss, and it's one of the hallmark signs of early dementia. What does it look like? They ask the same question again and again, forgetting they just asked it. They leave the stove or faucet running because they forget they used it. They misplace items in strange places, like putting the TV remote in the fridge and don't remember doing it. Or they walk into a store and suddenly forget why they came in. Meanwhile, long-term memories, like their wedding day, their childhood home, or the name of a childhood friend, remain vivid. That's because short-term memory is usually the first to be affected in conditions like Alzheimer's. I had a patient who could describe in detail the house he grew up in, down to the wallpaper. But when his wife asked if he'd taken his medication 5 minutes ago, he had no idea. She said, "He's living in 1965, but forgetting 9:30 this morning." That's when we knew the memory center of his brain, particularly the hippocampus, was under stress. So what can you do? Don't just watch for big memory loss. Pay attention to those subtle, repeated lapses in the present. If you're a caregiver, gently write things down. Use notes or pillboxes and create routines. These strategies don't just support, but they also help reveal patterns. And if these short-term slips increase, talk to a doctor. Early evaluation may uncover not only dementia, but sometimes reversible causes, like medication side effects, vitamin deficiencies, or thyroid problems. Because when your recent memories begin to fade, it's not just about forgetting, it's your brain quietly asking for help. And the sooner we respond, the more we can do.
8. Social confusion. When familiar faces become fuzzy. It's normal to mix up names once in a while. Calling your son by your nephew's name or stumbling on a grandchild's name during a busy holiday dinner, we all do that. But what's not normal is consistently forgetting the names of people you see every day, or using the wrong name, even after being gently corrected, and then doing it again just moments later. This isn't forgetfulness. It's a deeper kind of social disorientation. In the early stages of dementia, people may begin to lose track of how others relate to them, their roles, their names, their context. A wife is mistaken for a sister. A son is called by the neighbor's name. A caregiver is met with a blank stare even after years of daily care. These are subtle shifts at first, but over time they become more persistent and more painful for the people watching it unfold. I remember one woman whose mother began calling her by her sister's name again and again. At first, she laughed it off. But when her mother began forgetting who was who at family gatherings and couldn't recall the names of grandchildren she once adored, the laughter faded. It wasn't about rudeness or distraction. It was the brain's social mapping slowly fraying. So why is this important? Because our brains store relationships, not just faces. And when dementia begins to interfere with that network, names are often the first to go. What can you do? Be kind, not corrective. Constantly pointing out mistakes can frustrate or embarrass the person. Instead, gently reintroduce people with context. "Hi, Mom, it's Susan, your daughter." Notice patterns. Is the person confusing everyone or just a few individuals? Are they struggling more in groups? And if the errors become consistent, especially with close family or housemates, it's time for a deeper evaluation. Because when the people closest to us become unrecognizable, not to the eyes, but to the brain, it's a sign that something vital may be shifting. And it's in those moments, early on, that support and understanding matter most. 9. Disorientation in time and place, when the calendar no longer makes sense. Have you ever forgotten what day it is right after a long weekend? That's normal. But what if someone regularly thinks it's winter in the middle of July, or insists it's 2021 when the rest of the world has clearly moved on? That's something deeper, and it may be an early sign of dementia. This kind of disorientation isn't about forgetting to flip the calendar. It's about losing your brain's internal map of where you are in time and space. In the early stages, it might start subtly. A person forgets what day of the week it is, even after being reminded. They struggle to recall the current month or season. They underestimate or overestimate how much time has passed, or they seem confused about where they are, especially in familiar settings. One gentleman I cared for once asked me in February why it was so hot this Christmas. He wasn't joking. His mind was no longer anchored to time in a consistent way. And when your sense of time slips, so does your ability to plan, orient, and feel secure. This isn't just memory loss, it's a shift in cognitive mapping, the brain's way of placing you in the world around you. And once that starts to falter, tasks like cooking, driving, or managing appointments become harder. So, what can you do? Use gentle cues, calendars on the wall, clocks with dates, written schedules on the fridge. Reinforce time naturally. Mention the day, the season, or the holiday in conversation. Watch for patterns. If someone repeatedly says, "Wait, is it really July?" and they're not just surprised but genuinely confused, that's a flag worth noting. And don't dismiss it as getting older, because while some forgetfulness is normal, complete disorientation, especially when persistent, is not. When a person begins to lose their place in time, it's not just about the calendar. It's a sign their brain's compass may be starting to drift, and the sooner we notice, the more gently we can guide them back. 10. Communication breakdown, when conversations start to fray. We've all had moments when we lose our train of thought mid-sentence. That's part of being human. But when a person routinely struggles to follow or maintain a conversation, or repeats the same questions minutes apart, it could be a sign of something more serious happening in the brain. One of the early signs of dementia, especially Alzheimer's-type dementia, is a gradual breakdown in language processing and communication flow. It might look like this. The person can't find the right word, even for common objects. They pause mid-sentence, unsure how to continue. They start repeating the same question again and again, without remembering they just asked it. Or they answer in ways that feel off-topic or disconnected, as if their mind jumped to another conversation. I remember a man in his 60s who was once a gifted storyteller. But during our visit, his wife noticed he kept circling back to the same story, asking me the same thing 3 times in 10 minutes. He was trying his best, but the words weren't lining up like they used to. And he didn't even realize it. That's the heartbreaking part. Early on, the person may not be aware they're struggling to communicate, but those around them begin to notice the pattern. So what can you do? Be patient. Let them finish their thoughts, even if it takes longer. Avoid correcting or finishing sentences unless they ask for help. It can cause embarrassment or frustration. Gently write down repeated questions or keep a visual schedule to reduce anxiety. And if you notice increasing trouble following conversations, especially in someone who once spoke with ease, it's time to speak with a healthcare provider. Because language is more than words. It's connection. It's how we share love, stories, ideas. When those threads start to unravel, we must pay attention, not just for their sake, but for the relationships we hope to preserve. 11. Loss of safety awareness, when common sense becomes uncommon. One of the most alarming but often misunderstood early signs of dementia is a change in judgment, especially around safety. It can show up in quiet, almost unnoticeable ways at first. Leaving the stove on and walking away. Going for a walk at night without telling anyone. Putting car keys in the freezer or medication in the sugar jar. Trying to cross a busy street without looking. Or ignoring danger signs, both literal ones, like traffic signals, and social ones, like scams or suspicious phone calls. To the person experiencing it, nothing feels wrong. They may even argue, "I'm fine, don't worry about me." But to loved ones watching closely, something's off. The internal compass, the quiet instinct that tells us this isn't safe, starts to weaken. I once had a patient who began using the oven to dry towels. His wife caught it before anything happened, but when she asked him why, he genuinely didn't understand what the risk was. It wasn't carelessness. It was a neurological shift in judgment. This is more than forgetfulness. It's a loss of awareness, and it can quickly become dangerous, not only for the person affected, but for others around them. So what can you do? Look for patterns of poor judgment, not just one-off mistakes. Gently adjust the environment. Install stove timers. Keep keys or matches in secure places. Simplify surroundings. Have open conversations about new risks, but do so with compassion, not confrontation. And most importantly, don't assume they'll snap out of it. If someone is consistently underestimating danger, it's time to speak with a healthcare provider. Because staying safe isn't just about locked doors and guardrails. It's about the brain knowing what not to do when no one else is watching. And when that awareness begins to fade, your attention can make all the difference.
Visual misinterpretation. When the eyes still see, but the brain doesn't understand. What happens when someone can see clearly, but begins to misread the world around them? This is a lesser-known early sign of dementia, one that often surprises families. It's called visual processing difficulty, and it has nothing to do with needing glasses. Instead, it's the brain struggling to interpret what the eyes are seeing. It might look like this. A person stares at a stop sign, but doesn't realize what it means. They have trouble following directions on a map, or even understanding which way is left. They confuse shadows for stairs, or carpets for holes. They pick up the TV remote and try to use it like a phone. Or they look at familiar objects, but seem unsure how to use them. The eyes are working just fine, but the connection between vision and meaning, between seeing and understanding, is starting to break down. I had a patient who suddenly couldn't tell the difference between the men's and women's restroom symbols. He wasn't blind, but he'd lost the ability to process simple visual cues, and it deeply affected his confidence in public. This kind of issue can make everyday life harder and more dangerous long before memory fades. It increases the risk of falls, navigation errors, and misjudging distance or motion, like crossing a street or pouring a drink. So, what can you do? Watch for signs of confusion around everyday visual tasks, not just reading or driving. Simplify the environment. Avoid patterned carpets or complex layouts. Use high-contrast labels, clear signage, and good lighting. Encourage regular vision checks, but also know that when eye exams are normal, the problem may lie in the brain, not the eyes. And if someone starts hesitating with basic visual decisions or seems unsure in familiar settings, don't dismiss it. Because sometimes the brain isn't losing memory, it's losing its way of making sense of the world we see. And recognizing that early can help keep someone not only safer, but more confident and independent too. Personality changes when the person you know starts to feel different. Every one of us has our moods, good days, bad days, a short temper here and there. But when someone you've known for decades begins acting like someone else, it might be more than just stress or aging. A sudden shift in personality or behavior can be one of the earliest and most emotional signs of dementia. It could look like a gentle, patient person becoming irritable, more short-tempered, someone easygoing becoming suspicious, withdrawn, or even confrontational. A person who used to enjoy family gatherings now avoids people, or worse, lashes out. Or someone who used to be polite and warm begins using harsh language or inappropriate comments without realizing it. I remember a kind-hearted grandmother who started accusing her daughter of stealing her purse over and over again. She wasn't angry at her daughter. She was confused, frightened, and losing her grip on what was real.
These changes often stem from early damage in the frontal lobes, the part of the brain responsible for emotional regulation, impulse control, and social behavior. To loved ones, this can be especially painful. Not only are you seeing someone decline, you're seeing them act in ways you've never seen before. So what can you do? First, remember, it's the disease, not the person. Try not to take hurtful words or behaviors personally. Create calm, structured environments to reduce frustration. Loud noises, clutter, or overstimulation can worsen agitation. Keep routines predictable. Familiarity provides a sense of safety. And if a person becomes consistently aggressive or uncharacteristically emotional, seek professional guidance. These changes can often be managed with the right care and support. Personality doesn't disappear overnight, but when it starts to shift, for no clear reason, it's time to pause, reflect, and ask, is their brain trying to tell us something? Because while dementia may alter how someone behaves, it doesn't erase who they are. And with early understanding, we can preserve not only their dignity, but their connection to the people who love them most.
How to protect your brain. 3 actionable steps you can start today. The truth is, not all forms of dementia are irreversible. And even in progressive types like Alzheimer's, there are real steps we can take to slow it down, to protect what matters, and in some cases, to even reverse symptoms caused by treatable conditions. So here are 3 powerful, research-backed strategies I recommend to every patient and family I work with. 1. Investigate reversible causes first. Before assuming the worst, ask your doctor to rule out medical issues that can mimic dementia. Yes, some causes of memory loss are completely treatable. These include vitamin B12 deficiency. A simple blood test can detect this. B12 plays a vital role in brain function, and when levels are low, memory and focus suffer. Thyroid disorders, especially low thyroid, hypothyroidism, which can cause confusion, fatigue, and forgetfulness. Chronic infections like syphilis, rare but possible, and completely treatable with early diagnosis. Sleep disorders, especially sleep apnea, which deprive the brain of oxygen night after night. This can lead to morning confusion, poor focus, and long-term damage if not addressed. Don't let embarrassment or assumptions stop you from asking for answers. Sometimes a few simple tests and the right treatment can restore clarity and change the course of someone's life. 2. Build your cognitive reserve every day. Think of your brain like a savings account. The more deposits you make, learning, thinking, problem-solving, the more resilience your brain builds for the future. This is called cognitive reserve, and it's been shown to delay the symptoms of dementia, even in people with underlying brain changes. How do you build it? Learn something new, a language, an instrument, or even a recipe. Do puzzles, play chess, or try logic games. Stay socially connected. Conversations are one of the brain's best workouts. Watching videos like this, that counts too. Every time you challenge your brain, you strengthen its defenses. 3. Live a brain-healthy lifestyle. Your heart and brain are deeply connected. What's good for one supports the other. That means eat foods rich in healthy fats, avocados, olive oil, wild-caught fish, nuts. Avoid ultra-processed and high-sodium foods. They increase your risk of vascular problems. Exercise at least 30 minutes, 5 days a week. Brisk walking is a great place to start. Control your blood sugar and blood pressure. Vascular dementia is preventable. And of course, don't smoke and limit alcohol. Both take a toll on brain function. You don't have to be perfect, but small, consistent steps can protect your mind, not just for months, but for years.
Your brain has carried you through a lifetime, through love, learning, laughter, and loss. Now it's your turn to carry it, with care, with awareness, and with action. If even one of these signs felt familiar today, don't wait. Talk to someone. Ask questions. Share what you've learned. And if you found this video helpful, I invite you to subscribe, leave a comment, and share it with someone you love. Because when it comes to memory and dignity, early steps can make all the difference. And remember, you're not alone on this journey. We're walking it together. Until next time, take care of your brain. It's still got a lot of life to live.